Assalamu alaikum. I'm Professor Dr. Haider Jawad Mubarak. This is a presentation to practical aspects about the walls and floor of the pelvis. As an introduction, we must consider the bony pelvis. The bony pelvis is formed by four bones that are united by four joints. The four bones are the sacrum and coccyx posteriorly, and the right and left hip bones on the sides. These four bones united by four joints to form the bony pelvis. The joints are anteriorly the symphysis pubis, which is secondary cartilaginous joint between the right and left body of pubis, and also the right and left sacroiliac joints, and the last joint is the sacrococcygeal joint. In order to revise the anatomy in general of the bones of the hip bone, the hip bone is formed of three parts: the pubis, which is pink in color here, the ilium, violet in color, and the ischium, which is yellow in color. These three bones meet at the concavity of the acetabulum, as you can see. The pubis is formed of a quadrilateral body. The medial border of the body forms the symphysis pubis, while the lateral border forms the obturator foramen with the ischium. The body of a pubis, which is this one quadrilateral, have an upper border called pubic crest that end laterally with the pubic tubercle. And more lateral to the pubic tubercle, this is the superior ramus of a pubis, which meets the ilium at the iliopubic eminence, while the inferior ramus of a pubis meets the ramus of ischium. The ischium has a body, and the body has a tuberosity. We sit on the ischial tuberosity. In addition, the ischium has a ramus which unite with the inferior pubic ramus to form what is called ischiopubic ramus. The left and right ischiopubic rami form the infrapubic angle, or called the pubic arch. The ilium is formed of ala, which is formed by the iliac fossa from inside medially and the gluteal surface laterally. And the sacrum is formed of a middle piece and two lateral masses, right and left lateral masses, and there are many sacral foramen between the mid piece of the sacrum and the bilateral masses. In consideration to the bony pelvis, the bony pelvis could be divided by this line, which is called pelvic inlet. This line has other names other than pelvic inlet, for example, pelvic brim or superior aperture of the pelvis. The bony pelvis above this line, above the pelvic inlet, is called greater pelvis or false pelvis, which is mainly formed by the iliac fossa, right and left iliac fossa. This greater pelvis or false pelvis is part of the posterior abdominal wall, while the cavity of the bony pelvis below this line of pelvic inlet, the cavity below it, is the true pelvis or the lesser pelvis. And when we are talking about pelvic anatomy, including pelvic wall and the floor, we are considering the true pelvis, the lesser pelvis, below the pelvic inlet or below the pelvic brim. This line, the pelvic inlet or pelvic brim, or called inferior pelvic aperture, superior pelvic aperture, is formed by the promontory of sacrum. Posteriorly, the promontory is the anterior border of the upper piece of sacrum. The promontory form the pelvic inlet posteriorly, while the pelvic inlet anteriorly, it is formed by the pubic symphysis. On the side, the pelvic inlet or pelvic brim is formed by the linea semilunaris on the left and right side. And this linea semilunaris on the sides forming the pelvic inlet or pelvic brim is formed by the following structures from posterior to anterior. The first thing posterior is the anterior margin of ala of sacrum. This piece is called ala of sacrum on the right and left side. And the anterior margin of it forms the first part of the linea terminalis posteriorly. More anterior, the linea terminali is formed by the arcuate line of ilium, which is the medial border of ilium that separates the iliac fossa above it and the pelvic surface of ilium below it. This pelvic surface of ilium is the medial surface of the acetabulum. After the arcuate line, the linea semilunaris is formed by this line, which is called pectineal line or pecten pubis. That is the upper border of superior ramus of pubis. And then pubic tubercle, and then pubic crest is the more anterior part of the linea terminalis. The bony pelvis formed of the true pelvis, I mean the bones of the true pelvis below the pelvic brim, are the bony parts of the walls of the pelvis, because the walls of the pelvis are considered from bones, ligaments, and muscles. The inferior aspect of the bony pelvis shows the pelvic outlet, or called inferior pelvic aperture, which is diamond in shape. It is formed by the pubic symphysis anteriorly and body of a pubis, with infrapubic ligament below them, coccyx posteriorly, the symphysis pubis and infrapubic ligament anteriorly, with the inferior pubic ligament, sometimes called arcuate ligament, while the coccyx is posteriorly, and also the body of pubis with the symphysis from the boundary of the pelvic outlet anteriorly. Also, pelvic outlet or inferior pelvic aperture on the sides is bounded by the ischiopubic rami and the ischial-tuberosity and the sacrotuberous ligament. The inferior aperture is diamond in shape, also called pelvic outlet. So, if we want to talk specifically about walls of the pelvis, we will say walls of the true pelvis, walls of the lesser pelvis, below the pelvic inlet or below the pelvic brim. The walls, as we said, of the pelvis are formed of bones, ligament, and muscle. Starting with the bones forming the walls of the bony pelvis are the sacrum and coccyx posteriorly, while anteriorly the bones forming the wall of the pelvis are the body of pubis, and on the sides the walls of the pelvis is formed by the ischiopubic rami, ischial body of ischium, and pelvic surface of ilium. So bones forming the pelvic wall are the sacrum and coccyx posteriorly, body of pubis anteriorly, on the side ischiopubic rami, ischial-tuberosity, and body of ischium, pelvic part of ilium. This is about the bones forming the wall of the pelvis. Then ligaments forming the walls of the pelvis include obturator membrane that closes the obturator foramen, sacrospinous ligament, and sacrotuberous ligament. Sacrospinous ligament is a triangular ligament. The apex of it is attached to the spine of ischium, while the base of it is attached to the lateral side of coccyx and last piece of sacrum. While the sacrotuberous ligament is also considered as a triangular ligament, the apex is attached to the ischial tuberosity and the base is attached to the lateral mass of sacrum from the back. Both sacrospinous and sacrotuberous ligament transform the greater sciatic notch and lesser sciatic notch into foramina. This is all about bones forming the walls of the pelvis, and then ligament forming the walls of the pelvis. Now we will consider the muscles forming the walls of the pelvis. The muscles forming the wall of the pelvis are obturator internus anterolaterally and piriformis posterolaterally. Obturator internus attached to the inner aspect of the obturator membrane and the margin of the obturator foramen, while piriformis attached to the anterior aspect of the lateral mass of pelvis. You can see these are the sacral foramina, and piriformis is attached to the front of the sacrum, lateral to the foramina and to the lateral masses. Of course, this is a half to pelvis. This is the pubic symphysis and body of pubis. This is a midsection in the sacrum and coccyx. This is the arcuate line of Ilium, part of linea terminalis, pecten, pubis and pubic crest. You can imagine that this arcuate line is the medial border of Ilium. Above it is the iliac fossa. Below it is the pelvic surface of Ilium. So the anterolateral wall of the pelvis is formed by obturator internus, and the posterolateral is piriformis. In addition to the muscles forming the wall, the floor of the pelvis is only formed of a muscle. There is no ligament or bone in the floor, and the muscle is called posteriorly coccygeus and anteriorly levator ani. You can see coccygeus, the posterior muscle of the pelvic floor, is also a triangular muscle attached by its apex to the spine of ischium and by its base to the lateral side of the coccyx and last piece of sacrum. So it is the same of the attachment of the sacrospinous ligament. And actually, if you remove the muscle fiber of coccygeus, you will find the sacrospinous ligament deep to it. While levator ani originates from a long line starting from the back or pelvic surface of body of pubis, and then thickening of the fascia of obturator internus, and then the spine of ischium. The thickening in the fascia of obturator internus giving rise or giving origin to levator ani is called wide tendinous arch of obturator internus fascia. Levator ani, according to its attachment, is divided into two parts. The more anterior part is called the pubococcygeus, this one, while the posterior part is called iliococcygeus. And coccygeus itself, although it is not related to levator ani, some textbooks report it as ischiococcygeus, but the most common description is that this is a dependent muscle, which is called coccygeus, or ischiococcygeus, while levator ani is formed of two parts, iliococcygeus, pubococcygeus. Pubococcygeus is the anterior and iliococcygeus is the posterior. Pubococcygeus origin start from the back of body of pubis and extending to the anterior half of the tendinous thickening of obturator fascia, while iliococcygeus originated from the posterior half of the tendinous arch of obturator fascia. This is another view for the walls of the pelvis. This is the pubic symphysis anteriorly. This is midsection in the sacrum and coccyx. This is the arcuate line of Ilium. Above it is the iliac fossa. Below it is the pelvic surface of Ilium. This is obturator internus forming the anterolateral wall, while this is piriformis forming the posterolateral wall. In regard to pelvic fascia, the pelvic fascia could be classified as a fascia over the organs in the pelvis, which is called visceral pelvic fascia, and there are fascia on the walls and the floor, which is called parietal pelvic fascia. The visceral and parietal fascia of the pelvis have rules. The rules include that number one rule is that visceral and parietal fascia of the pelvis are thick over non-movable part or non-expansible part, and thin over expansible or movable part. For example, the urinary bladder could expand by when it is filled with urine, therefore the visceral fascia over it is thin, and so on. Well, the prostate fascia, the visceral pelvic fascia surrounding the prostate is thick because it is not movable, and actually the thickening of the parietal and visceral fascia serve for stability of visceral organs. Some of these thickening will form ligaments that should be considered separately with each organ anatomy description. This is rule number 1. Rule number 2, you can see in this figure, this is also a hemi pelvis, half pelvis. This is the pubic symphysis anteriorly, and this is a mid-sagittal section in the sacrum posteriorly, and this is the arcuate line. Above it is the iliac fossa, below it is the pelvic surface of ilium. This is obturator internus muscle forming anterolateral wall of the pelvis, and this is piriformis forming posterolateral wall of the piriformis. You can see that the sacral nerve projecting from the sacral foramina and running laterally on piriformis to enter the greater sciatic notch or foramen. And here also you can see the obturator nerve. In this figure, we will not be able to see the obturator nerve or the sacral nerves unless the fascia of obturator internus is removed and the fascia of piriformis is removed, because the nerves are running outside the fascia or deep to the fascia. So in that figure, we can see the sacral nerves and we can see the obturator internal nerve, because the fascia over obturator is removed so as to see the nerves, and the fascia of obturator internus is removed. Piriformis fascia is removed to see sacral nerves, and obturator fascia is removed to see the obturator nerve. And therefore the rule is that, the second rule is that the nerves are outside the pelvic fascia, and in comparison to the arteries are to the inside of the pelvic fascia, not outside. Therefore the nerves, when they exit out of the pelvis, they don't have to perforate the fascia because they are already outside, but the vessels, because they are inside the pelvis, they have to perforate the pelvic fascia to be outside. The other thing about fascia of the pelvis, that fascia of the pelvis is not covering bare bones. For example, this region of the bone, which is pelvic surface of ilium, that is the medial surface of the acetabulum below the arcuate line, is a bare bone. It is not covered by fascia of the pelvis. And one exception to this rule, that bare bone are not covered by fascia, is fascia of Waldeyer, which is between the anterior surface of sacrum and rectum, that must be considered with the anatomy of the rectum. One thing to be remembered, that obturator internus, we said that the fascia over obturator internus give origin to muscle which is levator ani. And therefore you can see that the obturator internus above the thickening, the tendinous arch or fascia of obturator internus, above it, obturator internus form the lateral wall of the true pelvis or anterolateral wall. But there is part of obturator internus below the attachment of origin of levator ani, which forms the lateral wall of the ischiorectal fossa. And another thing is that the levator ani is covered superiorly by a fascia and inferiorly by fascia. The superior covering is called superior fascia of pelvic diaphragm, and the inferior fascia is called inferior fascia of pelvic diaphragm. These superior and inferior fascia of pelvic diaphragm, with levator ani in between them and coccygeals, form the so-called pelvic diaphragm. This is one thing. In addition, the inferior fascia of pelvic diaphragm sometimes is called anal fascia. I have a synonym. In addition to inferior fascia of pelvic diaphragm, sometimes it is called anal fascia. So this fascia and the superior fascia and levator ani form the pelvic diaphragm. Another thing, this is a figure showing posterolateral wall piriformis, anterolateral wall obturator internus, and this is the tendinous white arch thickening of obturator fascia, giving origin to levator ani, and this is coccygeus muscle. You can see levator ani is formed of two parts. The posterior part is called iliococcygeus of levator ani, while the anterior part is called pubococcygeus. There is a classification for levator ani part, which is pubococcygeus. This figure shows that this is the posterior coccygeus muscle, and anterior to it, all of this is levator ani. And levator ani is formed of this part, which is called iliococcygeus. You can demarcate iliococcygeus here because it is originated from the posterior half of the wide tendinous arch of obturator fascia. Only the posterior half of the obturator wide tendinous arch. The anterior half of tendinous arch of obturator fascia and body of pubis, all these give to origin to pubococcygeus. So pubococcygeus origin start from the back of body of pubis to the anterior half of the tendinous arch thickening of obturator fascia. So this pubococcygeus part of levator ani is also subclassified into three parts, which are the first part, which is here number 1, is called pubovaginalis or puboprostaticus. This part originates from the medial half of back of body of pubis. Medial half of back of body of pubis. It is called the pubovaginalis because it surrounds the vagina. It is inserted into the perineal body and surrounds the vagina. It's named pubovaginalis because the contraction of this muscle have a clinical significance because it produces orgasm, contraction of the vagina during orgasm. While in male it is called the puboprostaticus as it supports the prostate here also. It originates pubovaginalis or puboprostaticus from the back of the medial half of the body of a prostate inserted into the perineal body. This is the first part of a pubococcygeus. More lateral to it, the second part, number 2, is called pubertalis. It originates from the lateral half of back of body of pubis, not the medial half, the lateral half, and going to encircle the anorectal junction, form a loop around the anorectal junction, and that's why it's called puborectalis. And the third part that originated from the anterior half of the wide tendinous arch of obturator fascia is called the pubococcygeus proper. Although all the three, 1, 2, and 3 are pubococcygeus, but number 3 that originates from the anterior half of the wide tendinous arch of obturator internus, thickening of fascia of obturator internus is called pubococcygeus proper. It is inserted into the anococcygeal raphe, which is fibrous tissue extending between the tip of the coccyx to the anus. This insertion of pubococcygeus proper is the same of insertion of iliococcygeus, that is the posterior part of levator ani, originated from the posterior half of the wide tendinous arch of obturator fascia. Of course, nerve supply and is from the S4 and inferior rectal, S4 and rectal, but are part of the theory of this topic, and function of pelvic floor is also part of the theory of this topic, and you need also to revise differences of the bony pelvis between male and female and part of the theory topic. You know, the bony pelvis of female should be wider than the bony pelvis of male because the bony pelvis of female should allow labor of the head of the baby, and therefore there are many features for the bony pelvis in female differentiate it from that of male. One of these or some of these are that the subpubic angle is wider in female, the bone as a whole is lighter in weight, the ischial spines are everted to outside, but in male they are inverted. The sacrum, anterior surface of sacrum is concave to enlarge the size of the true pelvis, while it is shallow concavity, it shows shallow concavity in the male. The obturator foramen is triangular in male, it is oval in female. The ischial tuberosity are everted to outside, where they are inverted in male. The inlet of the pelvis is oval in female, but it is triangular in male. And there are many other features. I think it is covered in your lecture. You have to consider it in practical terms regarding differences in the bony pelvis, sacrum, hip bone between male and female. Thank you very much.